Hello everyone, let us talk about general survey, vital signs and pain, which are a very important part of our health assessment. So what do we mean by general survey? It is the first impression. It is paying attention to nonverbal cues, and it also assesses many factors such as general appearance, apparent state of health, demeanor, facial effects or expression, grooming of your patient, and posture and gait. The apparent state of health, it makes general judgment whether your patient is on acute or chronic condition, whether he is frail or fit and robust, whether it looks his or her age, what is her age or his age, whether the patient is happy or unhappy, whether the patient is fatigued or rested. Level of consciousness, the general appearance, it gives you also a hint on level of consciousness, whether the patient is awake, alert, or responsive, whether the patient is oriented to place and time. Facial expression also give you a hint to whether the patient is rest, during conversation, examination with others, also eye contact, movement, um, if their movements are symmetric or not. When you observe for the posture, gait, motor activity, and speech, you need to look for the preferred posture, whether the patient is restless or quiet, whether there are any changes in position, whether there are how fast or slow are the movements, is there any involuntary motor activity, is there immobile or stiff joints, how is their speech, is it articulated, is it garbled, rapid or slow. Also, you need to see or to observe for if the patient is fatigued. There are non-specific symptoms with many causes, sense of weariness or loss of energy. Is there any, is the patient showing any depression and anxiety? Is he having hepatitis, for example, and jaundice? Is he having, for example, some of the conditions that may cause depression and anxiety or fatigue? So fatigue can be caused by all these conditions that I have listed, like diabetes, hypothyroidism, again, depression and anxiety, infectious mononucleosis, and some other diseases such as heart failure. Also, you need to monitor if the patient is weak, which gives you a hint that there is loss of muscle power. There is also a possible neuropathy or myopathy. Odors of the body and breath. You can identify if the patient is alcoholic, if he is taking acetone, for example, for suicide, if there is any pulmonary infections, there is any uremia, liver failure, or fruity smells that may indicate certain diseases. Is there any, for example, any odors related to their body, for example, that are related to drinking alcohol or cigarette smoking. Skin color and obvious lesions, that's something that you need to observe, and we will be covering it in chapter 9. We will also be covering dress grooming. You will also need to observe dress grooming and personal hygiene. So in terms of clothing, are they appropriate for weather? Are they clean, properly buttoned? Are their clothing appropriate for age, social group? Is the patient having any tattoos or piercing? If the patient is having any hygienic problems. Any signs of distress, such as cardiac or respiratory distress, clutching chest, pallor, diaphoresis, labored breathing, shortness of breath, tripod position, for example, tripod position. If the patient is having any pain by seeing their facial expression, like grimacing and crying. Also, if the patient is anxious, for example, you will see that their facial expression looks anxious. Fidgety movements, poor eye contact, flat affect, psychomotor slowing, which may indicate depression. Question number one, and you can answer this in our discussions. Although subjective finding dash is often referred to as the fifth vital sign, so which of these? Is it A, temperature, B, pain, C, pulse, D, affect? So it is a subjective finding, but it is always or often referred to as the fifth vital sign. So the answer is pain. So the basic vital signs include temperature, heart rate, respiratory rate, and blood pressure, which are four. Pain assessment is commonly missed and often not managed effectively. In order to ensure frequent pain assessment, it has been labeled as the fifth vital sign, especially in the hospital or rehabilitation setting. Let's talk a little bit about vital signs. So vital signs are an integral part of our health assessment. They are the most important part of health assessment actually, because it gives you an indication of what is happening in the patient body. So for blood pressure, there are certain recommendations. Here is the American Heart Association and the American Stroke Association recommendations. These are age-adjusted prevalence trends for high blood pressure, and it is increasing. So to check blood pressure, we need to choose the correct size of sphygmomanometer. We need to check if the cuff is small because is it narrow, blood pressure will be high. If the cuff is too large or wide, the blood pressure reading will be low or small. So we need to ensure equipment is functioning correctly and in good repair. So what are the steps to ensure accurate blood pressure? Number one, we need to instruct the patient to avoid smoking or drinking caffeinated beverages. We need to check to be sure room is quiet and comfortable, and also the patient to sit quietly for at least 5 minutes. We need to palpate the brachial artery for viable pulse, and then we position the arm so that the brachial artery is at heart level. If below heart level will be higher, if above heart level, the reading will be lower. So we need to make sure that it is at the heart level. If patient is seated, rest arm on table a little above patient's waist. If there is unrecognized auscultatory gap, may lead to serious underestimation of systolic blood pressure. So when you are listening with the manual blood pressure machine, if you cannot recognize if there is a gap, it may lead to serious underestimation of systolic blood pressure. Okay, so which is very important, as you know. So here in this picture, there is a description of auscultatory gap, or what we mean by auscultatory gap. So there is a silence, and then sounds of turbulent flow, and then silence again. So errors that result in false high readings may be if the cuff is too small, if the cuff is too loose or uneven, if the arm is below the heart level, if the arm is not supported, if there is an inflating or deflating cuff is too slow, which will cause high diastolic, if deflating cuff too quickly, low systolic and high diastolic. Errors that result in false low readings also may be because of the cuff, if it is too large. If also we repeat the assessment too quickly, if there is an inaccurate level of inflation, and also pressing the stethoscope too tightly against the pulse. So here is classification of normal and abnormal blood pressure, and I know you know all this. So let's talk about low blood pressure. It is relatively low levels by comparing to past readings and current clinical condition. It can cause orthostatic hypotension, which is a drop in blood pressure when the patient moves from lying to standing position. So it drops from the systolic reading may drop of at least 20 milligram per mercury, drop in diastolic reading of at least 10 milligram per mercury. So some special circumstances, there is weak or inaudible, what we call court cough sounds. We need to check the placement of the stethoscope. We need to consider possibility of shock. Arrhythmias, we may find, if in case we find arrhythmias, we need to verify it with ECG. There is also what we call white coat hypertension. So ask your patient to try to relax and measure it later during the visit. Also, for obese patient or very thin patient, use the correct size cuff. The hypertensive patient with unequal blood pressure in the arms and legs, we need to compare between the arms and legs. The reason is to compare the volume and the timing of radial and femoral pulses. Also, correction of the aorta and occlusive aortic disease. Like for example, hypertension may be in upper extremities, low blood pressure in legs, diminished or delayed femoral pulses if your patient is having an occlusion in aortic or aortic disease. Question 2. False low blood pressure reading can occur with all except deflating cuff too quickly, cuff too large, pressing stethoscope too tightly against pulse, repeating assessment too quickly. So please discuss this question with me during the. So the answer to question 2 is false low blood pressure readings can occur with all except deflating cuff too quickly. Deflating the cuff too quickly may result in a false high reading actually. So a false low reading may occur when the cuff is too large, the assessment is repeated too quickly, the level of inflation is inaccurate, or the stethoscope is pressed too tightly against the pulse. Heart rate and rhythm. So for heart rate, commonly we use radial pulse. If the rhythm appears regular and rate normal, count for 30 seconds and multiply by 2. If rate is unusually fast or slow, count for 60 seconds. The normal range for adults is between 60 to 100 beats per minute. For rhythm, we need to check if it is regular or irregular. If irregularities are noted, we need to assess apical pulse, and we will do that. And then we need to do early beats appear in, if early beats appear in a regular rhythm, we need to confirm that with an ECG. We need to compare it also with breathing. We need to regularly and irregularly, we need to check it if it is regularly irregular or irregularly irregular. ECG should be checked to assess irregular rhythms, as I mentioned. Now, respiratory rate and rhythm, we need to observe for rate, rhythm, depth, effort of breathing. So we need to obtain rate without letting patient know. We need to know that normal adult breathing is 12 to 20 breaths per minute. For the temperature actually fluctuates throughout the day, but the average temperature depends on the method used. So if it is taken orally, it should be between 37 Celsius. If it is rectally, it is 37.4 Celsius to 37.5 Celsius. If it's axillary, it's 36 Celsius. We call it hyperpyrexia if it is more than 41.1, and it is hypothermia if it is less than 35° rectally. Many options are available for obtaining temperature. So as I mentioned, it could be oral, rectal, tympanic membrane, temporal artery, or axillary. The oral one is not recommended for unconscious patients, for restless patients, for patients who cannot close their mouths, such as in patients who had CBA. So fever is an abnormal elevation of in-body temperature. Chills are feeling cold or shivering, and I brought this because people or students they usually mix between the um, two what we call two synonyms, or like the two words. Night sweats, it's feeling hot and sweating, which is accompanying a falling in temperature or a fall in the temperature. It occurs with tuberculosis, for example, or malignancy. Pain, which is the fifth vital signs, as I mentioned, it is one of the most common symptoms, and it is a very important symptom. So it's often under assessed and under treated. There is also a difference that you need to know between acute and chronic pain. So acute pain, it occurs suddenly with a recent injury or illness, and chronic pain is a pain that persists for more than 3 to 6 months, but occurring at intervals of months or years. So we need to assess patient history, onset, location, duration, characteristics, associated manifestations, relieving factors, treatments, and health disparities related. Types of scales. So health disparities such as patients of sickle cell disease who might be stigmatized when they come to the ER, and then they withhold or they don't manage their pain appropriately, unfortunately. Types of scales to assess pain could be visual, could be numeric, could be verbal, or it could be combination of pain scales. This is an example of a very famous pain scale. There are also types of pain that are like, for example, what we call nociceptive or somatic pain, which is related to tissue damage, neuropathic pain, which is related to direct injury to the CNS, psychogenic or idiopathic pain, which refers to many factors that influence patients' report of pain. Idiopathic is pain without identifiable etiology. So when managing pain, we need to focus on the 4 A's. First, analgesia, activities of daily living, adverse effects, apparent drug-related behaviors. So when recording the findings, we need to use vivid and graphic adjectives. We avoid glitches. We need to record vital signs taken at the examination. If the patient is having high temperature, we need to educate them on various routes and how to correctly obtain temperature, especially for those patients who are having infections or who are malignant or having like some type of malignancies. For pulse, there are certain health promotions that we need to keep in mind. That we need to educate our patients that there are some medications that we need to check pulses before administration. Say, for example, digoxin, which may lower the heart rate. Also, teach patients may lower or increase heart rate. Teach patients how to check one carotid pulse, so not the two carotid pulses. For respirations, we need to educate patients on how to count properly. For blood pressure, also, we need to ensure that the patient know how to check their. Question 3. To help with management of the patient's pain, a nurse should focus on the 4 A's to monitor patient outcome: analgesia, ADLS, adverse effects, and acceptable drug-related behaviors. Is it true or false? The answer is false. The 4 A's include analgesia, ADLs, adverse effects, and apparent drug-related behaviors.